as an example, early on, I was all about the money, right? I was, in Toronto, I was a new grad. I was like, I want to make, X amount of dollars per year. And day to day, like my happiness was like up and down on how much production I had and how much I was making. And it was pretty early on. I was like, man, this is not a good way to like think about dentistry of just like how much money am I making? Let's instead focus on my clinical outcomes. Like, is my restoration is looking better today? Is my marginal contours better? Is my contacts better? Is my extractions faster and cleaner? Is my post-op discomforts? So I had that mindset change, and it really made me happier because I was challenging myself to, learn the craft better day to day instead of just focusing on the money and the outcome side of it.
Hello, Protrusive. I'm Jazz Galati, and welcome to this Interference Cast with Omid Azami, better known as the host of the Noobie Dentist podcast. This episode was actually shot many months ago. Right now, when I'm recording this introduction, I'm quite nasal. I'm so sorry. I have got a bit of a non-COVID bug. It's bad timing, but at least it's non-COVID. I've got that confirmed. It's my sister's wedding at the moment. And for those of you who are familiar with Indian weddings, it's not like a one-day affair. I wish it was a one-day affair. This is like a 3-week bonanza. I am so grateful I have just one sibling. But anyway, let's make the most of it. I've got my son. I've got good food to look forward to, dancing, Indian colors and festivities and traditions. So I've got a lot of that going on. I've got a lot of the episodes on autopilot that have been pre-recorded. So they'll be getting released by the team over the next few weeks. So you won't go a week without having a Protrusive Dental Podcast episode. Don't worry. The themes that we cover in this episode are very much related and intertwines some of the previous themes that we'd cover. The theme of journey, the theme of career decisions, the theme of mindset, and the theme of just being the best version of you. The two biggest takeaways that you might get from this episode is, funnily enough, something I like to call toilet at university, and yes, I have no shame. And number two is something that Omid describes later in the episode as the social multiplier effect, and something that's so relevant in dentistry. So I hope you enjoyed me and Omid just, vibing out, chatting about dentistry in Australia, dentistry in the UK, and how to power up your mindset in dentistry. I hope you enjoy this one. Omid Azami, welcome to the Protrusive Dental Podcast. You are better known as the Noobie. Well, I don't know if you are the Noobie Dentist, but your podcast is called the Noobie Dentist. But maybe that was inspired by the situation that you felt in. So let's go straight in. What inspired you to make the Noobie Dentist, which, by the way, has been awesome. I've been listening to it. It's such a great resource. So please jump on and subscribe to Noobie Dentist as well. But you are the original Noobie Dentist. Tell us, how did that get to be?
I appreciate it, man. Thank you for having me on. I'm a big fan of your work as well and your podcast, and you're doing great things. Like I was telling you earlier, when I first started the podcast, it was sort of a small space. I mean, there was, Mark Costas and the Howard Franz of the world, and you kind of knew every podcast that was out there. It was a millennial dentist and, shared practices. So when I first started, there was a lot of business of dentistry podcasts. So I was, I enjoyed the topic a lot, how to start a practice, how to control your overhead, how to communicate with patients and case acceptance. But I didn't find a lot of sort of practical day-to-day clinical topics being discussed. And so I thought that was a cool niche that I personally, as a consumer of podcasts, wanted to kind of find and learn. And so at the time, it was 2016, I graduated from Melbourne Dental School, and I had moved back to Toronto, where I'm originally from. So I moved back and I was working in different practices, and I just didn't have a network because in Melbourne, I'm pretty outgoing and a good networker. And so all my university demonstrators and things were people who I, could rely on as mentors and things. But when I moved back, it was tough. I didn't have those people around me to help me with cases and how to deal with difficult situations. So early on, Instagram was pretty good as well. So I started the Noobie Dentist Instagram account first. And I said, okay, once I get this audience big enough, I'll try and convert that to the podcast. And obviously it's tough. It's hard to put yourself out there. You're nervous. Like, what if I make it? No one listens to it. No one, subscribes to it. So it took me a while.
Did you have the same, Omid, did you have the same objection that I had? The one I had, the biggest one I had was, I hate the sound of my own voice. Did you have that one?
It's cringy, man. I still cringe. I mean, I'm getting a bit better with it now, and I'm trying to become a better speaker and try and control that. But for me now, it's video because I've started to. You're good with video because you record your podcast and release them, but didn't dabble in video until recently, and that was a very big thing because I was quite shy to do that and things. But just getting back to the podcast point, it was about mentorship. I just wanted to connect with local dentists in Toronto first through the Instagram community. Started that, and it started to grow. And, eventually some dentists in the US and then abroad. And it was just a small hobby. And it's amazing how a couple of years of sticking with something, things can grow and expand and to see where things are. And, being here, having the opportunity to speak with you while you're in the UK and I'm here in Australia is just quite amazing.
It's so cool. And I know you've got this because you just mentioned it, but it is just the most flattering, humbling, sensational feeling when someone from like Kingston, Jamaica messages you, or I had a dental student the other day from Germany message me saying, I love listening to the Protrusive podcast or whatever. And you must get loads of messages from various countries over the world. And it's just one of the best feelings, and that really keeps us going in terms of making this stuff, because people, it's helping people, and your podcast has definitely done that. I mean, generation of young dentists, and I always say it's never been a better time to be a dentist than today, because there's so much. Definitely. I don't know how it is in Australia, Omid. Tell me, do you feel as the morale is low in dentistry, or do you feel like there's lots of like problems? Because in the UK, I don't know how much you know. I feel like you probably know a lot because you've had guests from all over the world. But the morale can be real low in the UK, and with the fear of litigation and the public sector and how that's funded, so the morale can be low. But my mission is to convince everyone that it's never been a better time than today to be a dentist. What do you think about that? I love that.
I think that's great, man. I really think that's a positive message to be spreading. It is true. Like, people get burnt out. I have friends, even myself, I've been through like the waves of the work is stressful. Your patients aren't always grateful necessarily. But I think the way you're approaching it in terms of education, learning, doing better work, providing better care for your patients, I think that's one way to kind of get out of it. I think, and the message I've been telling people in the podcast and things is how you portray, how you see dentistry is how you measure yourself in dentistry. So as an example, early on, I was all about the money, right? I was, in Toronto, I was a new grad. I was like, I want to make, X amount of dollars per year. And day to day, like my happiness was like up and down on how much production I had and how much I was making. And it was pretty early on. I was like, man, this is not a good way to like think about dentistry of just like how much money am I making? Let's instead focus on my clinical outcomes. Like, is my restorations looking better today? Is my marginal contours better? Is my contacts better? Is my extractions faster and cleaner? Is my post-op discomforts? So that's mindset change, and it really made me happier because I was challenging myself to learn the craft better day to day instead of just focusing about the money and the outcome side of it. So I do agree there's tough times, especially in the UK and other countries in Europe. You hear with the NHS and the reimbursements and things being so tricky. We have a lot of UK dentists here in Australia because they flee the public system there to come here.
The refugees of the dental system.
Yeah.
It's so true.
Yeah, it's definitely tough. I think we have it quite good in Australia in terms of insurance reimbursements and things still. So yeah, the litigation side is a big one. That personally weighs quite heavily on me as well, because we, most of us come from a good place and we don't do things to harm patients or don't do treatment with the eye of it failing. But if it does, and then patients come at you with that threat, it's just like a bad place to be.
How much, do you want me asking, how much is like maybe a dentist 5 years out of dental school, general dentistry, like you are, how much would you expect to pay for your, dental protection or insurance or whatever in Australia? Yeah,
so there's definitely different companies with different rates. I would say probably the lower end would be about $800, and then the higher end would be about $3,000. So that's like the sort of the range I would say.
Oh my goodness, these are Australian dollars, right?
Yeah, what is it like in the UK?
Okay, are you sat comfortably? You're not going to like faint,
yes,
right?
I'm
so the lowest of the lowest end, and this is a general dentist, not of like a public sector community. The general dentist, the lowest of the lowest of the lowest, is probably around about, and it's like after 5 years qualification, non-implant, nothing complicated. The lowest is £2,500, £3,000 is the lowest of the lowest, right? Yeah. You're looking at 6K, 8K GBP. Okay, and I know plenty of people are on that. And for a lot of people, it's the second biggest monthly expense after their mortgage, after their house, right? So the house, number one, number two is so it just paints a picture of what it's like, in the UK with litigation stuff. So that's why when I was in Singapore, I felt as though this like massive weight had been lifted off my shoulders. And it's good of you to sort of say that you feel yourself that maybe perhaps you don't feel as strangled by that, because the biggest thing you said was burnout was as a real issue. Whereas here, there's burnout, but there's so many other complicated factors. But I want to keep this episode positive, because there's so much positivity about you, Omid, as a person. And I love the fact that we're into the same things. Like, we're into the self-help, productivity, all these sorts of cool things. And you're always putting out these like weekly mentorship things, which people should totally check out, about how to be the best version of you. So my question to you, my friend, is, we have a lot of similar interests in that, in productivity, habits, that sort of stuff. Can you share your one or two biggest tips, dental or non-dental, for making our life more efficient, better, more productive? Yeah, so
like I said, I was thinking about this as I was running today, and I don't think I'm great. And I think that's the first thing I would say is like, have that mindset of like, it's a journey. You're never there necessarily. So you can always get better and do more. I'm very productive at consuming. information, I think. So like I said, I like to multitask. Like it's not often where I'm sitting at home or on commuting or even work where I'm not trying to like learn something while I'm doing something else. So I always have a podcast in the background or like a YouTube video in the background, which is good because you're always, learning and consuming it. But I think the next step of that I'm working on this year has been implementation. So you can always have the knowledge. You can, go to all these CPD events and learn a procedure in dentistry, or you can watch these tutorials or podcasts about investing or whatever it may be. But like that step of, okay, I've understood the factors, I know the knowledge, but now I need to like apply it to my real life. Take that step, buy my first stock, or, do my first implant, or take out my first tooth, or wake up at 5 tomorrow and actually do my morning routine, whatever it may be.
Do you do that? Do you do that, by the way?
It comes and goes. I'm pretty good. I normally try and wake up around 5:30, and I have like a thing that I do. And I think one of the videos that I did recently was, the cool thing about it is you don't need to be so regimented. I think you can have different phases where you try different things or whatever fits in your life at the moment. So for me right now, for the past maybe 6 months, 8 months, running has been probably the biggest thing outside of work that I focus on and spend time on. So my morning routine is like wake up, do my like morning mobility and things like that, and then have breakfast and watch like a YouTube investing tutorial because I'm trying to learn about investing and all that at the same time. So that's sort of it. But in terms of to answer your question, I'm going the long way around here, but one of the main things I use is like apps. So I use Trello. I'm not sure if you're familiar with that.
Yeah, I'm familiar with Trello. Yeah. Trello. Explain to everyone what Trello is. Yeah.
Yeah. So Trello is essentially, it's like a big to-do list. So you can have columns of things. So it took me a while to like really master my sort of the workflow there. So essentially how I have it right now, and maybe I'll share a screenshot or something of it, is I have, on the left side, I have like open loops, I call them. So there's like long-term ideas and plans and things that I want to get to one day. So for example, before I did the Noobie Dentist rebrand, that was there. Like it was there for months because I was like, I want to do it one day, just whenever I get the time. So those are my open loops. And then I have like my monthly, weekly, daily to-do list. So then I kind of drag it across. So like when the week comes, I'll be like, okay, I got to do these 10 things this week. Put it there, and none of those 10, I'm doing these 3 today. So that way, you don't, when you're time poor, you sit down, you just open up your Trello board that you've organized. I usually do that like on the weekend, on the Sunday or something for the week ahead. So when I wake up, I only have 30 minutes. I can just look through my list and like these 3 things I can just bang out right now. It'll take me 10 minutes to do it, and I'll do it. So that's been a big, time efficiency for me because I don't waste time thinking, okay, what do I have to do? What's next? What do I have to plan? Who do I have to contact? And then you get a nice dopamine rush because when you like take it to the completed list, then you see your completed task list grow. That's pretty rewarding as well. So that's, I guess, my tips are, one is productivity and consumption. So multitask, try and listen to a podcast when you're out for a run or at the gym or driving.
Toilet University.
Toilet University is good for YouTube videos. And so that's always fun. But and then try a to-do list. Like some people just like pen and paper. That works for most people. Like have a to-do list. I think I mentioned one that I learned from Kevin O'Leary on a YouTube video I was watching. Actually, is he has like a sticky note that he sticks onto his computer. 3 things that he's got to do first thing in the morning. So he does that before he goes to bed. And then when he wakes up, those 3 things are there, just gets it done, and then he can start the rest of his day.
I like that a lot. And I like your Trello system. So Trello is a really cool app. The way I've done it recently, which I found helpful as well, and maybe you try it this way, or maybe you will try it in the future, and let me know what you think about this, is sometimes with to-do lists, and I've got a massive to-do list here, man, and I found that sometimes, just like you had those open loops and you get round to it, whatnot, I had too many of those. And now I've started to integrate it more with Google Calendar. So now you have to, you put it into a physical space, and you've got like protected time for that. And I find that I'm getting more done because I've got that protected time. But there's always issues doing it that way as well. But I do like your Trello system because it breaks up into weekly, open loops, daily sort of thing. So I'm always looking for gems like that. So I might look at it again. I think it's good for teams. Like if you work as part of a team, Trello is good because it allows everyone to sort of access and tick things off,
for
right?
Sure. Yeah, but that's what we do with the podcast. And this is, like I said, this is just stuff I'm learning this year. And a lot of it goes down to my friend David, who has his own dental podcast as well. So he's very systemized, whereas I'm not as systemized of a person, but I'm learning a lot from him. So what's David's
podcast? Tell us so we can.
Dental Head Start. So it's an Australian podcast called Dental Head Start. Yeah, so he's doing great as well, growing quite rapidly, much like you are. Yeah, so I like that systemization. With the podcast, we have episodes that I've about to record, episodes I've recorded, episodes that have gone off to the editors, and then the guys that have helping me with the social media side of things know where things are at and can track it as well.
Do you think dentists can use this in practice? Do you think is this something that you can use as a practice manager? Have you heard of dental practices using a system like this? Because it sounds pretty good, actually. If you got the manager, the treatment coordinator, some dentists using a version of Trello to get more stuff done efficiently as a team, it would be an interesting thing to do.
For sure. And I think there's a lot of space to improve that in a lot of dental practices, right? Like not many of the practices would be that systemized, but I think it's such a nice visual tool. You can like color code different tasks and things in there. So, even like as an associate dentist, for example, you have like cases that are ongoing. You can have them on there. You have cases that you got to do a case presentation on or chase up lab work. I think it's a really useful tool for a dentist to use for sure.
And I like that dopamine hit you said, because sometimes, I don't know if you've ever done this, Omid, tell me, I make a to-do action and I tick it away straight then and there because I've just done it, but I need to register that I've done it. And I don't know, that's a level of obsession that sometimes you get when you have these dopamine hits. So I love those little gems. So guys, check out Trello. Also check out the Dental Head Start podcast, because I love promoting our own, our fellow podcasters and stuff, because it takes a lot of hard work and effort. And when you look at your website and stuff and the amount of visuals you have, the amount of great content you have, it takes a lot of effort. I understand more than anyone. So we have to support each other and send each other to these awesome podcasts. The next thing I want to ask is something that you've covered so many times, and I love it in your podcast, but I want you to introduce to my audience as well, is what makes a great dentist? Like, this is such a big question, right? Like, we all want to be this awesome dentist, but what do you think? Because you've spoken to such a huge variety of guests, and I feel like you've pinched a few things. You're like, as my colleague Zach calls it, you're like a patchwork quilt of all the other dentists or whatever, right? Or the average of the 5 dentists you spend the most time in, one of your recent episodes as well. But what do you think is the key attributes that's going to help a young dentist become great?
I think the main thing is communication. I think at the end of the day, regardless of your skill level, if you can communicate well with the patient, if you can get what you know or see in your head to the patient and make them understand why they need certain treatment, or even the consent thing, we talked about litigation and things like that. I think a lot of that comes to like poor communication, right? So, if you're good at warning the patient of what can potentially happen before it happens, it's a whole different conversation if it happens, right? Whereas if you've never warned them about it and, the instrument separated in your tooth, I was doing endo. If you've never warned them that this could happen or it does happen, then they look at you like you're making excuses at that point, right? So I always think communication is the number one tool for success, because you don't need to have the best hands. You may not be the best clinician, but if you can communicate really well, those are the really successful dentists. So that's one. The second thing is that internal accountability, because once you graduate, once you're working, there's no one looking over your shoulder. No one's telling you, you could do that a bit better. Maybe just do that again, or maybe re-prep that, or just refine that margin, or just take that impression again. It's not good. There's a bit of a bubble on the margin. You might just be in a rush. Your next patient's waiting in the waiting room, and you're just like, I'll just send it off. So I think that sets precedence, because if you are lax with yourself and you let your own standards slip, nobody else is going to really check you on that. So that adds up over time, and then you just build bad habits, and that has a big impact on you. So good communication, good internal accountability for, like, set your standard, because the quote is like, how you do some things is how you do everything. So I'm a big believer in that now. And I wasn't like that always. Like I said early on, I was all about, production and fast and speed. And it wasn't great because I let my internal standards slip. And eventually I was like, this is not the level of work I want to do. So I started posting on Instagram. I started posting my cases, and I started getting feedback. And that became the game then, was, okay, how can I get better, like, clinically? So I think that's the main two things I would say. And then the third thing is, obviously, it's an interesting one. It's like being selfish, like, have a good level of self-assuredness. You need to be confident in yourself and your own abilities. And the difference between that and being like egotistical is you're open to feedback and you're open to ongoing learning. So if you're assured, you say, I want to get better, you'll go to a mentor, you'll go to events or CPD events and courses and things, and you'll not be cocky about it. You're like, yes, I can improve, I can get better, I can learn, I can do that better. So I think that's the main 3 things: communication, internal accountability, and being self-assured. I
think I was going to say that 1 and 3, but even 2 to some degree of those 3 things, they definitely have the theme of emotional intelligence, having the self-awareness and the communication theme. It's not just verbal, it's the non-verbal, it's the empathy, it's the sympathy. So that screams emotional intelligence, which is great. And we've covered that on the podcast before. And number 2 point I'm going to go to again, because I want to emphasize that your own standards can drop so quickly. It's amazing, right? As a dentist, because you're right, no one's looking over your shoulder, and you just, the more shortcuts you take, and we've all done it, right? The more shortcuts you take, the more drags you accept in your impressions, or the technician will just guess where the margin is or whatever. But you're right, I completely agree with you that it's the taking the photos. When you start taking photos of your damn impressions and then you start showing other people's, there is no faster way to improve than that. So I'm so glad you've mentioned it there as well. I mean, do you tend to post cases daily, weekly? Because that's something I struggle with, time, especially with COVID, man.
I have so much respect for the clinicians on Instagram that are like prolific with that stuff. I started to, I mean, like with the Noobie Dentist Instagram page, early on it was more about, I would just like share what I was doing and with my cases and things. And, you know, it's just hard to maintain it. So I've just made it now just like a pure podcast sort of page. I don't really post like my own work or anything like that at this point.
Because it's tough, man. It's like you have to rotate your photos, crop them. Like people do amazing things, that they get the crowns and they overlay it beautifully onto the preps. I know how to do it, but I haven't got the time to go on Photoshop and do that. And it's amazing. And I'm not saying these people have surplus of time or anything. It's just they value that and they love that. It's a habit
as well.
It's amazing. It's so good.
Yeah.
Any tips to post more cases? Any tips you can give us? What can someone do to? Because yes, we've identified that you should post your cases or just take more photos. You don't have to post them, but take more photos. But how can you get into the habit? You mentioned habit, and something you spoke about in your podcast for as well. But what tips can you give someone to make a habit of taking photos? It's
early friction, right? Like with any new thing that you're going to take on, any new habit you're going to build, it's going to feel annoying. It's going to feel like it's taking too long, and it's going to be easy to give up right away because it's just like a new thing that you're trying out. So especially if it's not something you don't enjoy, like if you enjoy it, sometimes it's easier to form that habit. But if it's something that doesn't come naturally, you're not familiar with the camera, it's clunky, you got to take your glove off, you got to just slow things down. So I think it's just making a commitment to yourself. Okay, I'm going to take a photo every third case this week, and like not an ambitious goal, like I'm going to photograph every step of every case, because then it's more likely to fail. So I think pick a 1 or 2 cases ahead of time. Be like, I'm doing 3 back-to-back fillings on this quadrant, and I've booked an hour and a half. Book an extra 10-15 minutes. Just take your time, take your photos, and then look at it and then analyze it. How can I get the photos better? First of all, how can I make the work better clinically? And then I think that's the best way, because I think a lot of us, we want to start working out and we're like, I'm going to go to the gym 7 days a week. I'm going to wake up at 5. And you'll do that for like 2 days and then you just stop doing it, right? So I think that's the best way. Just pick 1 or 2 cases in a week, book the extra bit of time. I'm doing a nice crown prep Wednesday morning. Let me just give it an extra 10 minutes. I'm going to take good photographs. Look up before time how to use the camera. Look up some photos on Instagram and kind of see what can I mimic that? Can I imitate that? And then try and aim for that level. And then I think gradually you'll enjoy it and kind of start building it up from there.
And you have to make these. I love the term early friction used there. And you have to reduce the friction. You have to lubricate it. And the way I think you can lubricate the friction is by making sure that you tell your nurse, hey, I'm thinking of taking photos of this case, because if suddenly you say, let's take photos, and the nurse like, wait, we don't even have retractors in this room, right? Or where the mirrors, and to even warm your mirrors to prevent steaming or whatever. So you got to tell your nurse, you got to have that stuff out. And the biggest thing for me starting out taking photos a year out of dental school was I just have the camera out. Like it's like within arm's reach, right? It's like out. You should never be in a situation where you think, oh, I'm gonna take photos, but now I need to go into a cupboard, assemble the body to the lens, assemble the ring flash. That's the worst frame of mind, right?
That's just adding friction, right? It's definitely the opposite of what we're trying to accomplish there.
100%. So that's how we're going to lubricate our photography friction even.
Have it ready, plan ahead. Yeah. Tell people. There's accountability as well, right? If you tell your nurse you're gonna, I'm a huge accountability person, because I think if I tell my nurse, look, we have this crown prep at 9:00 today, I'm gonna take photos of every step, then you're more likely to do it as well, because they know they're planned, you're planned. The plan is in place, and then you'll execute it.
Accountability from the nurse also sounds cool, man. Right, the next question I have, because I'm going through these, because these are questions I get all the time, and I wanted to ask your perspective, because again, you've had these amazing guests on, is pathways, like, what kind of dentist do I want to be? And before I hit the record button, you were telling me about what you're up to, so maybe you can hear a little bit about what you are up to and where you want to be. But the most common thing, and even I found it, like, 3 years out of dental school, and I'm thinking, what do I want? How do I want to mold the rest of my career, right? Like, it's such a huge topic. Like, do I want to specialize? Do I want to do any advanced MSc programs? Do I want to be placing implants, or do I not want to be placing implants? And sometimes you have to make these decisions early on about which direction. And people say all the time, find your niche, right? Find your niche. Yeah. So the question I have for you is, Omid, have you found your niche? And also, what is your pathway likely to be? And then how can you self-discover where you're going?
Yeah. So I guess I'll start with answering the second one first, the journey of self-discovery. I think that's a really great question. It's such a broad specialty, right? There's so many different levels. And, what I'm about to say is not to like demean people who just, stick to their scaling cleans and just do like their fluoride and fish for seals. And then they just want that stress-free life and that's it. And they just come to work and that's it. That's fine. And there's a place for that. And a lot of people are happy doing that. One quote that I love is just like, you got to be the driver of your own ship, essentially. You got to be the captain of your own ship. So when you graduate, there's a lot of options. You may not necessarily pick the right option right away, but I think after a few weeks or after a few months of work, you start to realize, okay, do I want to work, in like a treadmill type practice where I'm just pumping out work? I'm not necessarily happy. I'm not necessarily enjoying the type of work I'm doing. I'm just trying to fill quotas and make money. And the clinical side of things is kind of slipping. The standard is slipping. Some people love that. Some people just like the flow and just want to pump it out, and their job satisfaction comes from the income, and that's fine as well. Other people are like craftsmen, right? They want to master the craft. They want to sit there. They want to take their time, like slow dentistry and the whole movement with like rubber dam fam and like all that kind of stuff on Instagram. But and they love that because they'll sit there. They'll spend an hour and a half doing a composite, even though they may not charge enough money to like make it worthwhile. It's not about the money for them. It's about the art and the craft and just getting better at that. So I think that's something that you got to decide for yourself is, do you enjoy the craft or do you enjoy the business side of it? Or do you want to just have a stress-free work environment, just come to work and clock in, clock out, and your passion comes outside of work and whatever, maybe hobbies and things that you have. So there's no judgment either way. You can everyone does. There's a whole plethora of that. There's public dentistry where it's like no stress. You can just put in GICs all day and just go home. Or you can do all-on-4 implants or orthodontics or advanced, high stress, high failure rate type of things, or like you're going home and you're stressed before you go to bed because you're worried.
High risk, high reward.
Yes, high risk, high reward. So for me, that was I worked in a lot of practices. I worked in Toronto and then I came back to Australia and I was working and I got to experience a lot of this. So I worked in a pump practice, treadmill practice in Canada. I was just really busy and I was a new grad and I didn't have the skill level to like keep up with the principal dentist. So my work quality was really bad. And I still look back and I'm still like, oh man, I feel bad for these patients. I should like call them and be like, are you okay? Like, can I still do your work again? But
we all feel like that. Don't worry. We all feel like that.
Yeah. And then I moved to Australia and I got a job in a really good practice with one of my old university demonstrators. And he's like a craftsman at heart. Like, we rubber dam even like a simple occlusal, we'll put a rubber dam on, we take photos, and the practice is set up for it. Like the nurses know that we're rubber damming every tooth. So I had a good year of just like high end, good dentistry, high standard of dentistry. And that changed my mindset from the production side to the let me get better as the clinician side. So I think that's the journey that a lot of people need to go on and decide what's for them. And then within that, then there's, okay, what do I enjoy? Like I tried the whole restorative route and it's just not for me. Like it's too finicky for me. I like more macro. And so I really fell in love with surgery. Like I'd much rather, break a root tip and get stuck for an hour trying to dig out the root tip than to try and just get invert my rubber dam so there's not like a little speck of blood coming up from the from the margin. So like that stuff, I hate it. Like I sat there and I'm like, like this restorative things, it's just too finicky for me. So, and surgery, it can be clean and art and finessed as well, but it's more macro. So it's just a bigger scale where you can just have a different level of control. So that's why this year I chose to sort of take a step back almost, a huge pay cut even to go back into the public system and do a 1-year sort of hospital residency training just to get really, really comfortable with like core oral surgery. So, wisdom teeth, surgical extractions, managing medically compromised patients. So from this, then I hope to move on, and I'm doing like a post-grad cert program in implants right now. So I think that's my niche will be, because I still will probably do some general dentistry. Like I'm not getting any sort of like specialist credentials out of this, but it's more so just to focus my practice on surgery, taking out wisdom teeth, taking out teeth, putting in some implants, because I think that's where I get my job satisfaction. I would honestly, I had this chat with the Real Tooth Doctor on Instagram. I've recently just podcast interviewed him. That'll hopefully come out in a couple of weeks. But we were agreeing that we would take out wisdom teeth for free, even like if just like come work Saturday, just take out wisdom teeth. Like I just love doing it. Like the satisfaction when the tooth like flicks out is just like nothing beats that for me. So that's been sort of my adventure and my path to finding my niche. I would say structured learning is important, right? So you mentioned the Master of Science programs in like King's and things. There's a lot of Australian guys that do those via distance learning, and then they come over to the UK to do the hands-on components. So I think that's, if you really want to find a niche, then you have to do something structured like that, because it's very hard to get that depth of knowledge by doing a weekend course here and there. So I would say work for a few years, see what you enjoy and don't enjoy, see what drives you crazy and what kind of keeps you motivated, and then maybe just pick what you enjoy doing and go depth.
I always look for a few gems in everything someone says, and you were packed full of gems there, but I'm just going to highlight one of them, which is the fact that you said you would do something for free, right? And so maybe for others, they'd be like, you know what, I can do class 4 composites and I would do it for free, because when that case comes through, or sometimes people come in and they've got like a dark central incisor, and then they will heavily discount the whitening rate because they love that satisfaction of getting that black central incisor going white again, and they get that lovely satisfaction from any certain type of case. And I think maybe that is one way that a dentist can identify what their true calling is, or what kind of work they need to niche down into. So that's a great way of saying it. So maybe dentists out there, we should think, is there any aspect of your clinical dentistry that you like so much that even if you didn't charge for it or was not as profitable as the rest of dentistry, that you think, you know what, I still do it? Maybe that's the answer. So I love that you shared that, and it's really made me think, hey, you know, what kind of stuff would I not mind doing? And that's a great way to put it. So thanks for sharing that. I think people will listen to that and think, yeah, you know, I can now identify what it is, because we all have that annoying friend at dent school who from third BDS, they knew they wanted to be an orthodontist, or they knew they wanted to, and they went straight into that path. But your path is very much, you're still self-discovering, but you've been through all the different sectors, because you have done public and the high-end practice, and then you came to terms with the fact that, hey, I don't like inverting dams, but I like getting root tips. So that's an important part of everyone. You have to struggle a little. You have to struggle a little bit, right, to find out what your niche is. Yeah, and
I always say, you know, there's no race. You know, some of your friends may be more talented or more ambitious or whatever it may be, and they might get there much faster than you. I think everyone needs to just everyone has their own kind of process and journey to get to where they want to get. And some people are late bloomers and they, you know, different things in life. I think that's one of the beauties of dentistry, because I definitely found this myself before starting this job was, you know, if I was, you know, focused more on the podcast, or I was more focused on, you know, training for a marathon or whatever it was, I could really easily just like turn down the dial at work. Like I would just like not take on big cases. I would just be cruising along at work. And then when I was like, no, I'm ambitious at work, I'm like, you know, presenting big cases and like getting all these like multi-unit like restorations and crowns and things. And so I found that really interesting, because you can really choose how involved you want to be at work as a dentist. It's not like you can be passive and refer things out, or you can take on hard things. It's really up to you and your appetite for how much you want to take on, essentially.
That's a mindset thing, isn't it? It's a mindset and how much you want to put yourself in a zone of discomfort or out of your comfort zone. And like I said, you can tone that down, you can tone it up, and sometimes in life, for your mental health, for burnout, you have to sometimes turn it down, and that's the way life is. And sometimes for your health, you have to do that. But I think when you're a new grad, turn it up as much as you can without entering the danger part. And I think the more mentorship you can get, the easier it is, the less resistance that dial has. And I think the key to that is mentorship. So you said you worked with someone who used to be a demonstrator at uni. Would you say that was a mentor for you?
100%. That job like redefined what dentistry was for me, because I went from, you know, the single tooth to come in, oh, you got a cavity there, let me fix it, to understanding, because he does a lot of ortho and things as well. So understanding like full mouth, you know, opening up video. And it was crazy because like I said, communication is a big thing for me, and you're the same way. You're a podcaster. Your you know, words come naturally. I'm sure you have great rapport with your patients. So I got really comfortable communicating, and I just didn't have the skills clinically to back up my cases. Like I would present the case like, okay, we need to like do a full mouth rehab, and you're like, yeah. I'm like, are you sure? Like I can't.
What do we do now?
So then that was great, because then I would just, you know, take photos, go next door. He would sit down with me for a few hours. We'd plan the whole case. This is what we need to do. This is, we got to add to this surface. We got to reduce this. And then I would come back with confidence and a full plan, and then just execute it. And that was like amazing, because it just changed how I was doing dentistry altogether.
I think you raised a really good point there, because sometimes you could be clinically excellent, but you are unable to communicate well enough to really help your patient self-discover and find the value in how much you can improve their life and health with the dentistry that you can give them, right? But then if you're on the other end, where you're just, my nurse sometimes thinks that I've got the gift of the gab with the patients and whatnot, but it's dangerous if you don't have the clinical understanding to back it up. And just again, you had that mentor. So I would say mentorship is a theme that can always...
That's the biggest thing in dentistry.
Exactly. In these types of themes of episodes, I think the mentorship's like the one thing that keeps coming again and again and again. And I've always said that you can identify a mentor anywhere. Like Frank Spear is a mentor of mine, I'd say. I've never met the guy. Okay, I just consume a lot of his content, but to me, he's a mentor. Like I can really resonate with what he says, and I learn a lot from him. So it's never been a better time to be a dentist. You can have a remote mentor.
That's the best. That's
anywhere.
So true.
Amazing.
Yeah, with online learning and distance learning, it's incredible. You can. Anytime you can sit at home and watch lectures from around the world from experts, and even social media is a great place to find mentors. If you really enjoy someone's work, you can just reach out with questions, and people are like amazingly free with information, right? You can reach out to like a periodontist in somewhere in the UK or in the United States, and they'll tell you exactly like, this is what I use, this is how I use it, this is the material, this is the grafting technique, blah blah blah. Like it's just amazing how much information you can get if you're hungry to get it.
In no other time in history could you just do that. Like you couldn't even in even early 2000s, you couldn't just reach out to anyone anywhere, and you couldn't just DM Pascal Magnier, you couldn't. Not that he ever replies to me.
Same here, man. I'm trying.
Pascal, listen, help us out, man. Omid from Noobie Dentist, Jazz from Protrusive, just help us out, buddy. Come on.
Yeah, it's amazing. I was listening to a book when I was running a few months ago called Grit, and I've talked about one of the weekly mentorship things. And it was an amazing idea that they introduced called the social multiplier effect. So the example they used was in basketball, for example. So in the United States, until pretty much the mid 80s, like NBA games or ABA games at the time, they weren't televised. So people wouldn't really get to see basketball at the professional level on TV every night. And then in the 80s, when they start showing basketball every night, kids be watching it. They go to the playground. They're imitating MJ. They're imitating, Dr. J. And so the kids are getting better. And then their friends on the playground see them doing it. They're like, what is that? Like, where'd you see that? And then they start practicing it. So when you look at the professional basketball player from like 1990 or even the early 2000s to the professionals now, the level of skill in the game is just like unbelievably advanced. And I think the same thing is happening in dentistry because think about it, like in 1970, if I was in Melbourne doing class 4 amalgams or class 2 amalgams, I have no idea what Pascal Magnier is doing in Europe or Matt Najad is doing in LA. I'm isolated, right? So now every day I wake up on lunch or toilet university, as you said, or looking at Instagram, and it's like, man, like this guy's doing this type of graft, this guy's doing this type of implant, this guy's doing this type of composite. So my understanding of what's possible, your understanding of what's possible is just like miles ahead of what a dentist 20 years ago would have been.
I'm so glad you introduced me to that. What's it called? The social
multiplier effect.
I love that. And you're so right. We see it in dentistry. And I'm going to go and buy lots of shares in Rubber Dam now after you said that, because it's true. Because everyone's isolation game, I think the percentage of dentists caring about Rubber Dam isolation has probably gone from like 2% to 20%. In the last few years, because we're all seeing it on social media, beautifully presented, and then we're starting to notice the benefits more. And just like in basketball in the 80s and televised, they used to see this, and now they're seeing all this awesome dentistry, and everyone's like, crap, I need to elevate my game, and I need to give a better service to my patients. And you're right, we are improving because it is more televised in that sort of basketball sense. I never thought about it that way, but you're right. So I'm going to buy shares in every Rubber Dam company there is because I think it's only going to go up, right? Yeah, that's the best part. And once I remember in dental school, I was like, man, once I graduate, I'm never using a Rubber Dam again. I said the same thing.
Honestly, now like if I have to do one without a Rubber Dam, I'm just miserable because like the tongue is there, the cheek is there. You just put your dam on, and even though I don't love doing restorations and whatnot, but it's still like a peaceful situation to be in once you got the dam on.
It's a stress-free situation. I actually accepted a new job in March, and part of the terms and conditions was, hey, I'll work, but you can never run out of the Unodent latex-free Rubber Dam. Is nice. Capiche? And everyone's in agreement. So that's amazing. Yeah. So I'm gonna wrap up now and ask you, You've had such amazing guests on your podcast, right? You know, you're just way ahead in the game of dental podcasting with the caliber of guests you've had. I'm still catching up, my friend. Honestly, the guests you've had are amazing. So tell me, who has, and without undermining any other guests, but this is a tough question, right? I hope no one ever asked me this, but who's been the most inspirational guest you've ever had on the Noobie Dentist? And what did they teach you? And what did they teach you? I know it's really unfair. I'm sorry.
Yeah. You know, there's so many that come to mind. Obviously, like one of the main ones, like just instrumental for the podcast, was like Bruce Freeman. So he's a orthodontist in Toronto, and he's, you know, become a friend and a mentor. He, you know, he's quite active in the dental community in Canada. So when he came on my podcast early on, maybe like episode like 12, 13, whatever it was, that was like a big turning point for the podcast in terms of downloads and exposure and things. So that meant a lot to me. And then we recently just did another like sort of 2-part episode about, and he's quite experienced. You know, he's much ahead in his career towards the end of his like clinical practicing life, and he's on to like teaching yoga and mindfulness and all this kind of stuff. So
wow.
I have a lot to learn from him in terms of, you know, staying like, you know, keeping the side hustles going. I love that. Because a lot of people at his stage of his career would be like winding down or maybe just, you know, comfortable with what they achieve. But now he's, you know, adding things. He's lecturing on patient experience and mindfulness and working with big, you know, dental corporations in Canada and things. So as someone who's a great clinician, good communicator, good side hustler, I've a lot to learn from him. So he's been one of the main ones. The other one that really comes to mind is like the implant ninja, like Ivan Chichon. I'm not sure if you've seen him on Instagram.
He came on the podcast for me as well. We talked about
really?
basic implant occlusion. We talked about, because I wanted to just niche down in that area. Ivan's such a cool guy. What a story he has.
Man, like his drive, his hard work, his story of like how he got into his specialty program. He just went over to like, I think it was Michigan from memory, and he's just like, can I just come shadow you? And then while he was there, he's like, can I just interview? I'm already here. And he just like hustled his way into the program. I have a lot of respect and admiration for his hard work, and like the amount of content and the courses and the everything that he puts out is quite amazing. So there's many others, but I think those two are the main people that I'm just like, I look up to. Like I wake up and I'm like, I want to be like them one day. I
really appreciate you answering those tough questions. I know that they're not easy, but that is awesome. Omid, really appreciate you coming on, my friend. I just wanted to get your word out there because the stuff you do with the weekly mentorship and all the other, you know, I say go back and listen to all the, you know, from the beginning of Noobie Dentist. There's some great content there. So Omid, thanks for giving up your time to come on my show. I really appreciate it, buddy. I appreciate the opportunity, man. It's great to talk to you. Like I said, your passion is quite infectious. I got to raise my game up and not at all, get to a level in terms of interview execution. But definitely, hopefully, we can return the favor and get you on the Noobie Dentist and talk. I know you're big on, you know, occlusion and night guards and splints and things like that. I think you can offer a lot of value to the listener. So we'll definitely arrange that. Awesome, my friend. Well, thanks so much, man. Hope you enjoyed that little session with Omid. Do DM us both on Instagram. Let us know what you thought of this episode. And I will catch you in the next one, no doubt. Make sure you stay up to date with everything by signing up to the newsletter, which is on protrusive.co.uk. Any sort of blog post or episode that you click into, pop-up will come up. You can put your email address there. There's loads of infographics to download. And also, of course, our famous Telegram group, which is protrusive.co.uk/Telegram, and our Facebook group, which is the Protrusive Dental Community. I'll catch you very soon, guys, in the next episode.